Hi, I'm Dr. Diva Boone from the Southwest Parathyroid Center. This is the Parathyroid Education course, and we're going to start getting into abnormal parathyroid function. You'll remember from the first video that parathyroids are normally regulating your calcium and keeping your blood calcium in a very tight range. That's what they're supposed to do. So when there's a problem with the parathyroid glands, we're usually going to see some problem with the calcium level. The calcium level will often be outside that normal range, either too low or too high. But to understand that, we need to know what exactly is normal. And this is tricky because normal may not be what your lab slip says. I'll get into that in a minute. But the first thing we need to know is normal varies with age. The labs don't always account for that. But as you get older, your calcium levels tend to drop. When you're a child or a teenager, you can have much higher calcium levels than when you're an older adult. So to get into the numbers of it, children and teenagers can have calcium levels that are up into the tens, the high tens in milligrams per deciliter. Whereas once you're above 40, you really shouldn't have any calcium levels that are above 10.0. If you're outside the US, you may be using millimoles per liter rather than milligrams per deciliter, and that 10 there is 2.50. So by the time you hit over your 40s, really you shouldn't see calcium levels above 2.50. Younger people, though, can definitely see those, and it's completely normal. And they tend to slowly drop with time. So teenagers can be in the high 10s. People in their 20s are usually kind of in the 9s or the mid 10s. Once you get to your 30s, you see it drop down. And then most of the people, by the time you hit 40, are solidly in that range of the mid to high 9s, like 9.3 to 10.0 in milligrams per deciliter. In millimoles per liter, that's about 2.3 to 2.50, around that range. So that's what we want to see. Most people who get primary hyperparathyroidism tend to be older adults, and they usually have high calcium levels. Now, the lab, though, may not specify that. So it is really important to check your own calcium levels on your labs. A lot of times the ranges given are way too large. So they'll give a range, for example, that is 8.8 to 10.4 as the normal range for calcium. That's not really a normal range. 10.4 could be normal if you're 25 years old. 8.8 really isn't ever normal. That's a little too low, but you do want to see that calcium level actually in the 9.3 to 10.0 range if you're an adult over 40. If you're younger, again, 10.3 could be normal, 10.4 could be normal, but if you're over 40, really that cutoff should be 10.0, and that should be labeled as abnormal. The labs, they do vary, so you may get your labs done at one place and get them done next week in another place, and the normal range varies. That is not because the lab has any special insight. It's just that slowly over time, labs have been contracting what they call normal. It used to be where normal was listed as up to 10.6, and now it's more common. I see up to 10.2 as being normal. So slowly they are contracting that range a little bit, getting closer to normal, a true normal. But I do still see some ranges that are really way too wide and out there. All right, so that's a normal parathyroid gland. That's normal parathyroid function. Parathyroid glands that are acting normally are trying to get the calcium in that range. Again, it's more like 9.3 to 10.0 in milligrams per deciliter, and about 2.3 to 2.5 in millimoles per liter. That's what you want to see on the labs. That's for total calcium. There are different ways of measuring calcium. Total calcium is the most common way, and it's usually pretty accurate for people who are outside walking around. Unless you have some really severe chronic illness or you're in the hospital, that total calcium level is going to be pretty accurate for you. So for most patients, all I have is the total calcium level, and I want to make sure that's in range. I want to actually look at the number. I encourage everybody to actually get your lab slips and look at the number to make sure it's in a true normal range, not just what the lab slip might call normal. Make sure that it's normal. If it's not normal, then you may have a problem. And that's where we start talking about checking the parathyroid hormone. So you'll recall normal parathyroid glands are making parathyroid hormone, or PTH, in order to regulate calcium. If your calcium level is normal, most of the time your parathyroid hormone level will be normal. If your calcium level is outside that normal range, then I really want to know what the PTH is, because I want to know what your parathyroid glands are doing. So, for example, if your calcium level is too high, I know that normal parathyroid glands, when they sense a high calcium, should turn off. They should stop making hormone. And so I should see a very low PTH level. So if I see your calcium level and it's high, and I check your parathyroid hormone level and it's very low, I say, okay, your parathyroid glands are doing what they're supposed to. We have to figure out another cause for your high calcium. But that's not the most common scenario. Most commonly, high calcium is due to a parathyroid problem. And what we'll see on the labs is a high calcium and a high or normal parathyroid hormone. And that is inappropriate. Any parathyroid hormone that is in normal range while the calcium is high indicates a problem. This is sometimes hard to get, but that's what happens with primary hyperparathyroidism. You have a high calcium and an inappropriate parathyroid hormone level. Because remember what appropriate is. Appropriate for PTH is very low in the setting of high calcium. If the PTH is not really low, like below the normal range, then that indicates that the parathyroid glands, at least one of them, is not responding appropriately. Okay, so it's really important to know what the normal range for calcium is. If that calcium is out of the range, it is really important to know what the PTH level is. And we can check PTH. It's a very easy blood test to get. It's not one that we routinely get. Calcium is typically checked as part of a metabolic panel, either a basic metabolic panel or comprehensive metabolic panel. This is often included in your yearly labs. So if you go to the doctor annually and they do your regular blood tests, calcium is most likely included in that. PTH is not going to be included that unless your doctor specifically requests it. And you're usually not requesting it unless there is a problem with the calcium or you suspect there may be parathyroid disease. Usually the first indication that you might suspect it is seeing an abnormal calcium level. All right, so everybody should know what the normal range is now and what we're looking for if we see something out of range. And next time we'll talk more about how we diagnose primary hyperparathyroidism.